rotator cuff issues can take quite a long time to get better, or I don't mean like that acute pain, but getting them 100% can take quite a long time because the shoulder is extremely muscular. There's only 4 rotator cuff muscles, but the whole shoulder works together, the whole shoulder girdle. So there's various different techniques and strategies we can use to fix the rotator cuff. First, we're going to do just some soft tissue therapy, so some myofascial release type of technique. So essentially we're going to get the arm moving kind of like this. We're just creating tension along the length of that muscle, and that should just feel like a nice gentle stretch in through this area. This usually feels really good, and that can be extremely helpful in improving that range. These posterior structures to help loosen those up, that can take a ton of tension off the shoulder. Again, we need to look at the whole body, how it's moving and why the shoulder's getting beaten up, but just for simplicity's sake, this is how we more address the shoulder. So this is for some more persistent pain or more chronic pain, just nothing is kind of resolving that. We just get the, again, we can use shockwave, and we just get this on here. I'm not going to turn it on, but we put the gel on, and we essentially move that around, and we get on those muscles and those tendons, and it can be extremely effective in helping reduce shoulder pain and rotator cuff issues. It can be a little uncomfortable, but it can really get the job done. Usually 1 or 2 sessions, you notice a really big improvement. One of the keys with rehabbing the shoulder is we got to make sure that the scapula are stable, and oftentimes these muscles kind of get ignored. You get people doing a lot of like lifts and stuff like that, but they ignore the mechanics of how the shoulders are actually moving. Another effective exercise to help strengthen the shoulder girdle is just palms up. So just some band pull aparts about there, and then just keeping your arms kind of straight, and then just pull the band apart, really squeezing this upper back. Get that upper back, the posterior delts here, this whole posterior chain that oftentimes gets neglected, and we need to strengthen that up. These are just a couple just simple exercises that can be really effective.